Hello, my name is Sara Austin. I am a neurologist. I decided early on that I really liked to go into school, and this seemed like a good way to go to school for a long time, and I wasn't wrong about that. And then I think a lot of times it was just luck, because it turns out that I really like taking care of people and being a doctor, and so it was a great choice for me. I started out in internal medicine, and I ended up choosing neurology because I just was really interested in the brain, and the problems that neurologic patients have really interest me. I like to listen to people. I actually enjoy being in the room with people, and I really like to puzzle solve. So it's one of my favorite things to sit there with kind of a difficult problem and try to go through all the choices and figure out what's really wrong. I really like my job, and the thing that I like the most is being in the room with a person, and if it's a problem that's kind of tough to figure out, I think that's a lot of fun. But I still like it because I still spend an hour for most appointments, and so I have time to talk to people and kind of get to know them a little bit. I like that part. So I think it's important to spend time with people and to listen to what their complaints are. I think it's also important at the end of the visit to explain what we found, and I also try to write down things, because I know people are like me; they can't remember, what somebody told them 10 minutes later. So it's important to give people time to talk. I usually try to get people to tell me their story in sort of chronological order, and it helps me think through their problem and try to figure it out. Outside of the hospital, my hobby is really advocacy. It's legislative stuff, and so I've worked with the Texas Medical Association. I was the previous president of the Texas Neurologic Association or Society, and anyway, I really like how healthcare impacts government, or government impacts healthcare. That's really sort of what is a lot of fun for me.